Hello everyone, my name is Richard Xia, and today we will be talking about cancer screening. Most of the guidelines will be from USPSTF, and there were some updates on it last year, so I thought this video will be helpful. Some objectives: we'll talk about breast cancer, lung cancer, colorectal cancer, cervical cancer, prostate cancer, ovarian cancer, esophageal cancer, hepatocellular cancer, and some other cancers. For breast cancer screening, the most recent guidelines are from 2016 from USPSTF, and we do a screening mammography. So for women aged 40 to 49 years, the decision to do cancer screening is individualized and it's a shared decision making. For women aged 50 to 74 years, a screening mammography should be done every 2 years. For women greater than or equal to 75 years old, current evidence is insufficient, meaning we don't know if the benefits outweigh the risk. And self-breast exam screening is not recommended according to USPSTF. For lung cancer screening, the most recent guidance are from 2021, and this is done by a low-dose CT scan. It is done annually for ages 50 to 80 years old who have a greater than or equal to 20 pack year smoking history and are currently smoking or have quit within the past 15 years. And screening is discontinued when a patient has not smoked for 15 years or more, or develops a health problem that limits life expectancy, or if the patient doesn't want to have curative lung surgery, so therefore we will stop screening. For colorectal cancer, the most recent guidelines are from 2021. For patients who are age 45 to 49 years old, it's a grade D recommendation to have a colorectal cancer screening. In ages 50 to 75 years old, it is a grade A recommendation to screen for colon cancer. For patients 76 to 85 years old, the screening should be individualized, depending on the patient's overall health, their medical history, prior screening history, and patient's own preferences. I also want to talk about why I really agree with decreasing the age to 45 years for colorectal cancer screening, because when I was an intern in residency, I took care of a lot of patients who came with abdominal pain, and they were all less than 45 years old, and they all were found to have metastatic colon cancer. So I really agree with this recommendation. So what screening tests can we use for colorectal cancer? So there are various tests we have listed here. I want to say colonoscopy, screen patients every 10 years if their prior screening are normal. And that's the best test, it's the gold standard. And if patients don't want to go through colonoscopy, we offer them a high sensitivity guaiac fecal occult test or a fecal immunochemical test known as FIT, that's done every year, or a stool DNA FIT test that's done every 1 to 3 years, by telling patients that we should do them every year. Or patients can go through a CT coronography every 5 years, or a flexible sigmoidoscopy every 5 years, or flexible sigmoidoscopy every 10 years, plus an annual FIT test. For cervical cancer screening, these guidelines are from 2018 on USPSTF website. So for women less than 21 years old, no screening is recommended. For women aged 21 to 29 years old, it is recommended every 3 years with a cervical cytology alone, and that's a grade A recommendation. For women aged 30 to 65 years, you can either do every 3 years with a cervical cytology, or every 5 years with HPV testing alone, or every 5 years with HPV testing in combination with cytology co-testing. And these are grade A recommendations. The reason why for women 21 to 29 years old, HPV testing is not recommended is because age 21 to 29, they can clear the HPV virus. So even if we find a positive test, there really isn't much to do and doesn't really change management. So for women who have had a hysterectomy with removal of their cervix, it is recommended for against screening, and women who do not have a history of high-grade precancerous lesion such as CIN grade 2 or 3, or history of cervical cancer. And for women greater than 65 years old, screening for cervical cancer can stop if women had adequate prior screening and are not at otherwise high risk for cervical cancer. For prostate cancer screening, major guidelines say that it's a shared decision making and you screen with a PSA. And screening does not appear to reduce all-cause mortality and has conflicting evidence regarding reduced prostate cancer specific mortality. For ovarian cancer in low-risk women, major medical organizations do not recommend screening. For esophageal cancer, screening is only recommended for patients with a history of Barrett's esophagus, and the screening is done by endoscopy, but the frequency and surveillance varies depends on the presence and degree of dysplasia. For hepatocellular cancer screening, in selected patients with hepatitis B, patients with cirrhosis from causes such as hepatitis C, primary biliary cirrhosis, hematochromatosis, alpha-1 antitrypsin deficiency, it is recommended to screen with a liver ultrasound every 6 months. And it's also recommended to do a hepatocellular screening in patients on the liver transplant list waiting for a transplant. Other cancers include bladder cancer, skin cancer, pancreatic cancer, anal cancer, gastric cancer, and thyroid cancer. For bladder cancer and skin cancer, USPSTF finds insufficient evidence against or for screening. For pancreatic cancer, USPSTF recommends not performing routine screening. And for anal cancer, major groups have not made any recommendations. And for gastric cancer, it is recommended to screen in patients with a history of hereditary cancer syndromes or family history of that. And in thyroid cancer, it is recommended to screen high-risk family members of patients with the listed thyroid cancers, such as men type 2A, men type 2B, or familial hereditary thyroid cancer. And these are the references. The majority of them are from USPSTF and also a resource called DynaMed. So that's all, everybody. And if you thought this video was helpful, please like, subscribe, and look out for my next video. Thank you.